It comes out of nowhere, a sharp, stabbing pain in the lower back that drops ground men to their knees. They call it the kidney stone attack.
This is the culprit. A jagged, crystalline rock made of waste chemicals.
Your kidneys are the body's filters. They clean the blood and produce urine to carry away waste.
But if you are dehydrated, the waste becomes too concentrated. Crystals begin to form. Calcium binds.
Over weeks or months, the stone grows. Layer by layer, it becomes a hard, jagged rock.
Eventually, the stone moves. Pushed by the flow of urine, it leaves the safe of the kidney and enters the ureter, the long tube leading to the bladder.
Here is the problem. The ureter is a tiny tube, only 3 to 4 millimeters wide. The stone gets stuck. Its sharp, crystalline edges dig into the delicate lining of the ureter. The tube spasms violently. With the exit blocked, urine backs up. The kidney fills with fluid and swells like a balloon under high pressure. This swelling stretches the kidney capsule, triggering intense nerve signals. This is renal colic, a wave. The pain is too much. At the hospital, doctors perform a CT scan, the gold standard for finding stones. The scan confirms it. The stone is 9 millimeters wide. In the past, this required cutting you open. Today, we use ureteroscopy. We don't cut the skin.
This is the ureteroscope, a long, thin, flexible telescope. It carries a fiber optic camera and a light source. The patient is asleep under anesthesia. The scope is guided up the urethra, into the bladder, and steers.
Guided by the camera, the African-American female doctor steers the scope up the narrow ureter tube. It is
There it is, the obstruction, a jagged mass of calcium oxalate wedged tight against the inflamed walls. Now we deploy the weapon. A laser fiber, thinner than a human hair, is threaded through the scope. We have two choices: break it into chunks or dust it into powder. We choose dusting. We set the laser to high frequency to vaporize the surface.
The laser is activated. The energy creates a microscopic bubble of plasma.
The surgeon paints the stone with laser pulses. The heat and shock waves chew through the hard mineral, turning the solid rock into a cloud. This is called dusting. The particles are now so small, like grains of sand, that they can simply float out with the urine without causing any pain.
Sometimes larger fragments remain. We cannot leave these behind. To remove them, we deploy a specialized
It works like a claw machine. The basket is carefully.
With the prize secured, the surgeon slowly withdraws the scope, dragging the stone all the way down the ureter and out of the body physically. The stone is gone, but the battle leaves scars. The ureter often swells up immediately after surgery.
To prevent this, we insert a temporary safety tube called a DJ Stent.
Using a guide wire, the doctor slides the stent up the ureter. It acts like a scaffold, physically pushing.
Why is it called DJ? Because once the wire is removed, both ends curl into a J shape.
Now, urine can drain freely through the hollow tube, bypassing the swelling. The kidney is safe, and the pressure is relieved immediately.
The stent is a lifesaver, but it's annoying. As you move, the plastic coil can rub against the bladder wall. It stays in for a few days to a week. Once the swelling goes down and the ureter heals, it's time to take the scaffold out.
If the doctor leaves a retrieval string attached, removal is easy. The string hangs outside the body, and the doctor.
But usually there is no string. The patient returns to the clinic. The East Asian male doctor inserts a smaller scope.
The tool grabs the end. With a steady pull, the stent uncoils and slides out in seconds.
Prevention starts with physics. If your urine is dark and concentrated, stones form easily. If it is clear like water, the minerals can't stick together.
Some healthy foods like spinach, almonds, and rhubarb are loaded with oxalates. For stone formers, these are the fuel for the fire.
Don't stop eating calcium. In fact, eating dairy with your meals binds the oxalate in your stomach, so it leaves your body before it ever reaches the kidneys. And finally, lemons. They contain citrate, a natural chemical that coats crystals and prevents them from sticking together.
The stone is gone. The pain that brought you to your knees is just a memory. The body heals, and the plumbing flows freely again.
But remember, the best surgery is the one you never need. Drink your water. Keep the river flowing.
We live in an age where we can vaporize rocks inside the body without a single cut. It is a triumph of medical engineering.
If you feel that sharp pain in your back, don't wait. The sooner you catch it, the easier it is to blast it away.
Did this satisfy your curiosity? Hit subscribe for more medical deep dives. Next up, how surgeons replace a human knee with metal. See you there.